Well, frontline health workers in many countries, including Italy, the US, the UK, have been complaining about a lack of personal protective equipment, which makes their jobs more dangerous. In the UK, the government says a national supply team supported by the armed forces is working around the clock to deliver equipment. So let's hear how that feels on the front line by speaking now to Dr. Michael Brooks, who's been working in the James Paget University Hospital in Great Yarmouth. Thank you very much for joining us, Michael. You're obviously not wearing your protective equipment at the moment, but have you got enough now?
Yes, actually. The response from the James Paget Hospital has been very impressive. It's a hospital that's always really prided itself in patient safety and staff safety. And really, at the very start of this outbreak, they'd organised themselves quite rapidly to provide us with equipment. So when I went in after the guidance from the World Health Organization was released on the 19th of March, we found that they had provided us with the full equipment. We had respirators, we had gowns, we had gloves. And then when the subsequent guidance was updated by Public Health England, they then also provided the equipment that Public Health England have been suggesting that we use. So far, no sign of shortages. We've always found the boxes are refilled when they need to be refilled. So actually, at this particular hospital, because of its focus on staff safety, I've actually felt pretty safe.
And turning to the actual challenges of the job, I know yours is not one of the huge inundated hospitals, but you are seeing COVID-19 patients. How is the mood among the staff? Do you feel you can cope with what you're faced with?
So here in East Norfolk, we're a little bit behind London in terms of the caseload. We're maybe up to a week behind, but we are very definitely seeing cases, and they are increasing on a day-by-day basis. At the moment, we're coping. We've got capacity still, although it is filling up rapidly. The staff have been very well prepared. We've split the departments into two, into a hot zone and a cold zone, and there's a solid plan to run from. So the trust has been extremely good. The one thing nobody knows in the whole department is how high this peak is going to be. So we don't know how bad and how busy things are going to get. We can only guess, and I think there is an underlying fear, trepidation that we may get overwhelmed. But at the moment, the feeling is, yes, the work's hard. Yes, you're spending 10-hour stretches in a gown when we're working in the resus area. But there's a feeling that, yes, we're coping.
Leslie, for the general public in the UK, the news of the past 24 hours about the Prime Minister has brought a certain gravity, a sense that this disease does not discriminate, power and privilege do not protect you in any way. It's also, we've all seen BBC coverage from inside the intensive care unit of a big London hospital. And I think that has also driven home to people the very seriousness of the disease and what it can do at its worst. Is it something that you worry about and your colleagues worry about as you see more cases coming in?
I think the underlying worry is there. I mean, we do see in the emergency department, we do tend to see some pretty extreme things, and to a certain extent you get desensitized to it. And I think the overwhelming sensation is that we're doctors and nurses. We want to get out there and help people. That's the number one drive. You do have in the back of your mind this worry that, well, if I do get infected, am I going to be one of the sort of 80% that has a mild course, or am I going to be one of the unfortunate 20%? And at the moment, from my latest reading, we really don't know, other than if you've got certain underlying health conditions, we don't know why some people have a rough course and other people don't have a rough course. So I think the underlying fear is there, but our main motivation very much is to get into the department, get on and help the patients that need it, because that's what we do, and that's our passion.
Michael, thanks so much for talking to you. We wish you and all of your colleagues and all of your patients all the best.
Thank you.